Good morning and welcome back to the Pulse Point. My name is Dr. Gina Weeks, and I'm excited to have Mrs. Allison Wright here with us today, our clinical coordinator, and we're going to talk a little bit about clinical onboarding for our part-time faculty. So thank you for joining me.
Thank you for having me.
We all kind of feel that mix of emotion on our first day of clinical, right? Whether we've been a clinician for a long time or not, it's just that excitement of, we want our students to be successful. So how do we really do that? But it's really challenging because we all come with like different experiences and how we were onboarded as a clinical faculty, which kind of creates some educational like disparities between
a little bit of gaps.
And so to kind of ensure that everybody's on the same page, we thought it'd be really good to bring our clinical coordinator on board, and we're going to do a clinical series called the Clinical Onboarding Compass. So it's going to be a 3-part series, so stay tuned for the other 2 parts, and we're just going to kind of go through what those expectations are for our faculty, full-time and part-time, our students, what the paperwork looks like, what our clinical facilities are expecting from us, and then just some of those professional standards that we need to uphold. So, we really desire in the School of Nursing to have that seamless transition and have that equitable experiences for our students. So I think this will be really helpful for everybody involved. The first thing I want to talk about is really setting the stage for like a successful clinical experience for our faculty. And let's get on to that onboarding process and what that looks like, because I know it's very rigorous.
Yes, it definitely can be the hardest part of clinical, which is weird because you feel like being in the hospital, taking care of patients, doing your theory to practice would be the hardest, but I almost feel like onboarding can be a little bit tricky sometimes.
Right.
So it's important that we go through this stuff so students feel supported as well as faculty.
Right.
So it just depends. The most important thing with the onboarding process is that there's usually 2 weeks that we need everything done prior to the start of clinical.
Okay.
That's not only for the students, but also for the facilities, because they have to do the same thing that we're doing, make sure, okay, Dr. Weeks has all of her stuff ready to go with this clinical group, they're cleared to start, right? They might need to get badges, they might need to have certain clearance, they might have to have Pyxis access, stuff like that.
Right.
So we try and do at least 2 weeks prior, just so if there's any loose ends to tie up, then we can tackle those prior to the start. So then they can start on time rather than having to wait another week to get everything situated.
Okay, that's good to know. And, we try to onboard our students pretty early. We have our intake day where they kind of get all the information on what is going to be expected of them to get that medical clearance done. And then we come back to boot camp and we really want that stuff done so that our faculty have enough time to get all that paperwork in.
Yes.
And so I know you were saying that with like different clinical facilities, different agencies, they're going to maybe require different things. So we really need to make sure that our faculty know that. So how would the faculty know where to find like what they need? Say if they're going to go to Kaiser versus RCH versus RUHS.
So that's a great question. So most everything's on the resource page on Canvas. And it should be the clinical resources on Canvas for the faculty.
Okay.
Everything is on there, Kaiser, RCH, RUHS, and every facility does do something different, which how nice would it be if everybody just did one fluid thing, right?
Right.
But for example, RCH requires us to have student stuff in 30 days before.
Okay.
Other places, so Kaiser, it could be the day before. As long as they have everything in, they'll send us clearance. So it really just depends.
Okay.
And also, if there's ever any questions with paperwork or onboarding process, everybody knows that they can come to me as well.
Okay.
Because I'm kind of the guru at this point on what goes where and who
Right.
and what's happening. So that's kind of nice too. Yeah. So I'm always available for that too. But the clinical site materials are pretty much where you can have everything. I also created a kind of an onboarding packet that goes through each site and kind of tells bullet points of like the gist of what's needed for each clinical site, and that's also on that resource page as well.
Okay,
so something they can reference.
Yeah, so the faculty, just so you guys know, again, we have that faculty resource page like Allison was talking about. All those clinical resources are on there, so I would strongly encourage you to get on that Canvas page. There's lots of good other information on there too, for all the different clinical sites. And I think onboarding is getting, like you said, more challenging because they all want different things. And so we're really trying to hone in on it and make it as seamless as possible for our faculty. So I appreciate you kind of taking that lead with that.
Yes, because we want a smooth transition.
Right.
So, for example, different clinical platforms, right? So Riverside Community just changed in the beginning of the year to something called My Clinical Exchange, which is a certain platform. St. Bernardine's also uses My Clinical Exchange, but they use different files within My Clinical Exchange. So that can be a little tricky.
Right.
RUHS and Redlands use Clinician Nexus, but RUHS uses Clinician Nexus and they also use something called Moodles for their education. Redlands just uses Clinician Nexus and everything's within that platform. It's very different.
Yeah.
So it's very difficult. So even when you feel like, oh, I got it, next semester they could say, oh, actually we're moving to just paperwork at this point. We don't want to use that platform anymore. Because My Clinical Exchange does cost a fee to use. And so kind of Dr. Van Hol, she's been paying the fee through the School of Nursing for those students rotating at St. Bernardine's and RCH to kind of incur some of those costs.
Yeah, that's good. Yeah, and I know a lot of the hospitals are starting to charge money for those onboarding fees. So it's something we need to be mindful of too, because we're a community college, so we can't necessarily offset that cost to our students.
Exactly.
Thank you. You're always on the ball, keeping up with the latest kind of what's expected from the clinical facility side. Now let's talk about faculty. So I'm a new faculty, or maybe I'm not a new faculty, right? Most of our part-time faculty are our graduates, which is great. We love having our graduates come back. I think it speaks to the excellence of our program when you want to come back and teach in the program. But I always feel like with that, sometimes they look at things from a student perspective and they don't necessarily look 100%. At things from a faculty perspective. Mm-hmm. And so we need to recognize that they're amazing clinicians, and of course, because they were trained by us,
right.
But they're still novice educators. And so we need to not bring a lot of assumptions into what they should know and what they don't know. So let's just say, I'm a newer faculty member. I'm a graduate of the program. I did all my clinical onboarding. How do I make sure that the students are really, meeting those objectives? What would you tell a part-time faculty to access, essentially, to know what should my students be doing this week? What are they learning this week? What are those objectives?
So we always try to tie in our theory with our clinical. So it's really important that the part-time faculty or just full-time faculty in general try and do that. It's important to have a course objective schedule as well with the course schedule. So like this week they're learning GI. Okay, let's give them patients with GI. So that's really important so they can because I'm a very tactile, I have to see it, do it, touch it. That's how I learn, right? And a lot of people are like that. And so I think it just helps the students so they can go in and go, okay, I'm learning GI right now. My patient's GI. Oh, this is all clicking now.
Right.
So we try and give them the clinical schedule on top of the lecture and theory schedule so they can look at that and think like, oh, okay, so their focus is this week. Oh, they're doing strokes. Let's try and get them some stroke patients, or at least some stroke medication so we can kind of see and correlate the difference between the two,
right.
So.
And I think that's really important because we talked about it as a leadership team and even as a faculty body that sometimes students see theory independent from clinical and they don't see that bridge. And I think at the clinical site, that's where we're really seeing that practice gap. They're not connecting the dots and theory and then applying it at the bedside. So I think it's really important that our lead faculty have those meetings with the part-time faculty before that clinical rotation starts and give them access to the syllabus, give them access to the Canvas. So, it's not going to be match per match, right?
No, yeah.
But at least if I know, hey, this week we're doing cardiac, this week we're doing renal, I could try to seek out patients that fit that content so that students can start to connect the dots a little bit better.
Well, you want everybody to be set up for success too, right?
Right.
So I think doing that really sets the students up for success, which sets up the program for success, which makes us as faculty feel we're successful because we're watching these students blossom and grow into these amazing nurses. So that's really important too.
It is. Okay, well, thank you for that. And then I think the last point that I want to kind of talk about briefly is holding the standard. I think that's one thing that we have a lot of inconsistencies within the program, because maybe we're not communicating what that standard is well enough for everyone to know what it is. So when I talk about holding the standard professionally, what do our faculty need to be looking like when they're going into that clinical setting?
Well, I think that really, if it's kind of, you dress for success, right? So you go to clinical, you expect the students to be in their uniforms ready to go. So faculty should be in scrubs, lab coat on to differentiate them. Because if you show up at clinical, you're in scrubs, someone else in scrubs. Mm-hmm. I work there. I don't know anybody. So I'm like, I don't know if that's the instructor. I'm not sure, right? So faculty should be just the same as students, ready to go, scrubs on, lab coat, ID badge. If you work at that facility, like let's say I'm teaching at RUHS, but I also work there. You do not have an RUHS badge on because that's not the hat that you're wearing that day. Right. That's a false identification, which people don't really understand. Mm-hmm. But if there's people walking around, they're going to assume you work there, but really you're wearing RCC hat today.
You're at RCC.
So, so that's really important too. Hair back, minimal earrings, no artificial nails, things like that.
Right. And I think that's important because as a professional, you have to role model those behaviors. So if we're expecting students to be a certain way and to act a certain way and to look a certain way, then as faculty, we need to role model that too. And also, we're a guest in the facility. So it's not a matter if we're practicing there or not. We have to abide by those standards and what their regulations are with their different OSHA guidelines too. So that's really important to kind of keep in mind. Again, faculty, we have a student handbook. We have a faculty handbook with all of the policies in it that you can access on that faculty resource canvas page. And we have a uniform policy, and we need to make sure that we're understanding what that is for our students too. So can you speak a little bit about that?
Yes, so students should be in uniform. Uniform means the smock, the pants, their RCC student nurse badge on. Their hair needs to be back off their shoulders, kempt, not bangs in the face hanging down. If they have facial hair, it needs to be trimmed, no tattoos showing, no stars and hearts and butterfly pimple patches on their faces, no rings of any kind, just really showing that clean, kempt look that they're ready to go for clinical and start their day.
I know in the VM program, we're looking at our students when they're coming into lab and saying, gosh, you're in full uniform. And when you're in full uniform, you have to be in full uniform. So even if you're not in clinical, because I know a lot of students are like, well, I'm just here practicing in the lab. It's like, no, you're in uniform. Your hair needs to be back. Piercings need to be removed. Tattoos need to be covered because that is what is expected at the clinical facility.
I think it's kind of, in a weird way, it's muscle memory too, which is a weird reference, I feel like. But if you know, like, today is a uniform day, so this is my uniform outfit from head to toe, we never kind of have to second guess, like, ooh, can I wear that second hoop in my ear? Can I have this color polished on? Well, I'm only on campus, but no, you're in your uniform, so that means uniform, it's game time, ready to go.
Right, game time, absolutely. I agree with that. So again, we do have a full uniform policy for our students that you can, I would encourage you to read, understand it, and hold students accountable. And if you continue to have professionalism issues with students, we have a progressive performance improvement plan that we'll talk about in another episode. I actually think that's kind of all we have time for today. Thank you for joining me again today, Allison. I appreciate everything that you do.
Yeah, of
and
course.
Thank you guys for watching the Pulse Point. So stay tuned for our second and third episode on our Clinical Compass, and we're going to keep going on this to keep that consistency going. Have a great day.